We got to get back to the fundamentals because we've totally skipped over, for instance, that thousands of years we assume people did not have a gender and a sex when we did research. Like
Right.
who would ever think we skipped over two human variables that everyone has and we know
Right.
impacts research. But also I think the successful health relationship in the last chapter that we talk about, the pyramid, and asking yourself, where are you at in that pyramid with you and your provider? And have you been seeing your provider for 10 years, 15, 20? And are you at the top of that pyramid, which is results? Because if you haven't like traversed that pyramid, it's like Maslow's hierarchy to self-actualization. Some women are still right here at the physiology. Like, I'm able to get out of bed, get dressed, do what I need to do during the day. But when I'm going to talk to my provider, they're gaslighting me. And
Right.
I've been seeing this provider for so long. You can get a new. I think we need a multi-pronged approach. So we need to educate our consumers, which is one of the reasons we wrote this book. And the other piece is continuing to educate our future providers by getting this information into a learning environment. And that can be a classroom, a clinic, a global health experience. And then we really need to have more public health campaigns around new information. I mean, you're talking about a 3 to 4 week follow-up for postpartum, and that is in large part due to some of those higher mortality and
Yep.
also depression and postpartum psychosis, which we miss.
Yep.
And that is very important. So at the time that we're telling OBGYNs this is important to do, we also need to be telling women who are pregnant or thinking of getting pregnant, you need to see your doctor between 3 to 4 weeks because of XYZ.
Right.
And why it is important. So women will take care of themselves if you impart onto them how important it is for them to be able to take care of their families. And if we can't diagnose it with lab testing or physical exam or history taking from that woman, it's often relegated to stress or anxiety or depression. And yet there are many conditions that we're still learning about. And we talk in the book about if something is called a syndrome, that typically means that we don't have a blood test for it or an x-ray for it.